Your baby puppy grows into a dog over 4 stages. In stage 1, they'll sleep a lot. Next, there's play and exploration. And more play. That's stage 2. It's fun for everybody, especially puppies. In stage 3, stronger bones lead to greater speed. Look at that pace! And now, they're well on their way. They grow fast, an amazing 1700% from birth to adulthood. That's why Royal Canal's stage-based puppy growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby kitten grows into a cat in 3 stages. In stage 1, they'll sleep a lot. Then, they'll begin to explore and have fun. It's how they start to learn catness. That's stage 2. At stage 3, they become quicker and stronger, even more bold, even more curious. They grow fast, an amazing 5700% from birth to adulthood. That's why Royal Canal's stage-based kitten growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby puppy grows into a dog over 4 stages. In stage 1, they'll sleep a lot. Next, there's play and exploration. And more play. That's stage 2. It's fun for everybody, especially puppies. In stage 3, stronger bones lead to greater speed. Look at that pace! And now, they're well on their way. They grow fast, an amazing 1700% from birth to adulthood. That's why Royal Canal's stage-based puppy growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby kitten grows into a cat in 3 stages. In stage 1, they'll sleep a lot. Then they'll begin to explore and have fun. It's how they start to learn catness. That's stage 2. At stage 3, they become quicker and stronger, even more bold, even more curious. They grow fast, an amazing 5,700% from birth to adulthood. That's why Royal Canal's stage-based kitten growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby puppy grows into a dog over 4 stages. In stage 1, they'll sleep a lot. Next, there's play and exploration. And more play. That's stage 2. It's fun for everybody, especially puppies. In stage 3, stronger bones lead to greater speed. Look at that pace! And now, they're well on their way. They grow fast, an amazing 1700% from birth to adulthood. That's why Royal Canal's stage-based puppy growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby kitten grows into a cat in 3 stages. In stage 1, they'll sleep a lot. Then they'll begin to explore and have fun. It's how they start to learn catness. That's stage 2. At stage 3, They become quicker and stronger, even more bold, even more curious. They grow fast, an amazing 5,700% from birth to adulthood. That's why Royal Canal's stage-based kitten growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby puppy grows into a dog over 4 stages. In stage 1, they'll sleep a lot. Next, there's play and exploration. And more play. That's stage 2. It's fun for everybody, especially puppies. In stage 3, stronger bones lead to greater speed. Look at that pace! And now, they're well on their way. They grow fast, an amazing 1,700% from birth to adulthood. That's why Royal Canal's stage-based puppy growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life. Your baby kitten grows into a cat in 3 stages. In stage 1, they'll sleep a lot. Then, they'll begin to explore and have fun. It's how they start to learn catness. That's stage 2. At stage 3, they become quicker and stronger, even more bold, even more curious. They grow fast, an amazing 5,700% from birth to adulthood. That's why Royal Canal's stage-based kitten growth program provides their precise nutritional and health needs, giving them the ideal foundation for a healthy life.
Hello, pet parents. Welcome for this wonderful session of Ask Your Vet. Myself, Dr. Vishal Dangle. I welcome all of you on behalf of Royal Canin India. In this changing environment or scenario, it's really difficult to take care of pets because we know that the situation is volatile outside, and at the same time we are most of us are locked down or having so many restrictions around it. At the same time, in this continuously evolving world, as a pet parents or pet lovers, we must also evolve, or we must also try to adopt new things or new skill sets so that we can be with the world and we can be in a position to take care of our pets in better or efficient manner. So today, without further delay, I would like to take all of you through this particular session where we are bringing pet parents and renowned veterinarians on the same platform. And this platform will be the one beneficial platform for everyone, which will help you all to get your queries resolved. So let's start. I will be sharing my screen with everyone. So welcome once again, pet parents, for this episode of Ask Your Vet. This is the first session of the series of Ask Your Vet. And today we will be discussing about vaccination and deworming in case of puppies and kittens. So what is the particular campaign and why it is a need of our? So basically, an education is very important, and for that we launching a campaign called Take Your Pet to the Vet. So here the objective is that we want to create an awareness about the preventive health care and management in case of pets. We also want you to understand your pain points, your queries, and we will try our level best to provide solutions from our end to those queries, whichever is possible to us. We also want to bust certain myths around, let's say, the basic preventive health care and management of the pets, like vaccination, deworming, and so on and so forth. And at the end, we also want you to provide a platform where you can interact with the renowned veterinarians and you get your doubt solved. At the same time, some of the critical queries also we would like to answer during these sessions. So what is Take Your Pet to the Vet as a campaign? So it is a campaign which talks about the preventive health care and management in case of pets. So we will be sharing, or we will be having one topic we'll be discussing under the umbrella of Ask Your Vet, maybe responsible pet ownership, or do it yourself, where we will be requesting you to do certain kind of a observation at home which can give you the hint about the health and well-being of your pet. So we will take your help with the help of educating, with the help of veterinarians, with the help of a digital platform, and we will be guiding you about the some kind of ailments or symptoms identification, so that you can take your pet to the vet well before the situation become worse, before the matter become difficult for the pet. We will be also providing free health checkup going forward. We are working on this. We will be collaborating with the veterinarians, and we will be onboarding veterinarians for this novel program. And we will be rewarding the pet parents with a free health checkup coupons, so that they will get their pets free health checkup done regularly, and their pets will be living a healthy life for longer period of time. And we will be also at the same time giving certain rewards, and we will be recognizing those pet parents going forward in the future. uh, so since we are talking about rewards for the today's event, we are giving away this different rewards for you, which will help actually, which will be beneficial for your pets. And 10 lucky winners will be identified basis the different questions you ask, basis the uh, basis your participation in this particular event. I request all of you to keep sending your questions into the chat box. We already received more than 300 questions. We sorted out certain important questions which we will be asking to today's renowned veterinarian, and we will be trying to get answers from the respected veterinarian. But meantime, you will also have an opportunity to win this kind of a gifts for your pet. And please try sending those questions. At the same time, you can also take part in the poll questions which we will ask during this session, and those who answer those questions in shortest period of time in correct manner will be rewarded with the goodies. So without further delay, for today's Ask Your Pet, we have a renowned veterinarian who, with his skills, with his dedication, hard work of more than 35 years or so in this particular industry, earned himself the respects, who is a renowned, a kind of a legend in the pet industry of India, and he is also globally recognized, none other than Dr. Umesh sir. So I request Umesh sir to please appear on the screen.
Good evening, everyone, and I hope I'm very audible to all of you.
Yes, sir, you are very well audible.
I'm so happy to be with all of you today in the afternoon, and I'm sorry if I'm disturbing anyone's sleep today. But we are going to talk about certain important questions and answers and the topics which we would like to discuss about the kittens and puppies' health. First of all, the acquiring a puppy or kitten is such a
Sir, first of all, let me give you your brief introduction to the audience because they would like to know more about you. And I know it will take more than 1 hour to only introduce you. So I will try my level best to at least give few important information about you to the audience. So first of all, Umesh sir is, as I told you, practicing more than 35 years in this particular industry. He is even before I born. So it's again honor and privilege to have sir and myself. I feel it's very humble, and I feel myself lucky that I got an opportunity to host this particular event. So those who are pet parents, I also want to share that sir is already have published 8 odd papers for research articles for under veterinary public health. Sir is also worked as a research assistant and associate professor in Bombay Veterinary College between 1985 to 1990. Sir is also a participant in Cornell Cardiology Group at Cornell University Hospital for Animals as a visiting veterinarian in 2006, 7, and in 2012. And sir is a very active member of One Health Committee of WASAVA, which is a World Small Animal Veterinarian Association. It's a globally leading body. And he is the one who is not only promoting the One Health, One Medicine, but he is also implemented this particular concept and practicing this important aspect in his regular life. So this is we are so lucky that we have Sir Umesh sir today. And I request again all of you, please take this as an opportunity to ask questions as much as you can. And we will try also to forward those questions or ask same questions to the sir and get solutions of it. Over to you, sir. The first I request sir to talk about the basic healthcare tips for both puppy and kittens.
Again, thanks Vishal for the introduction, and I'm really humbled to be in front of all of you. Whatever I could do in the last 35 years in my practice, I learned from a lot of my peer, my colleagues, veterinarians, global teachers, which I could engage them in continuing education in India for the veterinarians. And I'm grateful to some of my friends, which are breeders, trainers. I learned every day small practicing skills from them. So I will be very happy to help any one of you as far as the healthcare of their puppies, kittens, or dogs concerned. Now, coming back to today's talk, puppies, healthcare, and puppy is something which comes with a lot of joy. For the breeders, that delivered puppies are very, very important for him, that they stay very happy and healthy till they are given to the respected owners. But for the owners, it's very important to understand what they are doing right now. So they are picking up the puppy, which should be the healthy, but certain tips are essential. So when we talk about puppy's health, we talk about puppyhood as a stage of a massive physical and behavioral development. Imagine a puppy which is 2 weeks of age, shut his eyes and start moving, crawling with a sensation around. Now this puppy transforms into a big dog, which is an adult of various sizes, but then there is a huge differentiation between these, each and every breed. So their puppy goes through an amazing transformation from a very young age. And that young age is the age where it's very, very important that puppy gets a sufficient amount of a nutritionally balanced food, which can help and control the puppy's development further. Puppy develops its eyesight, puppy develops its hearing capacity, puppy develops its neurological sensations, puppy develops its physical and anatomical structures, skeletal structures in that crucial period. We come back to some of the most common tips which I normally offer to my clients. It's when the puppy is there, start playing with the puppy so that you read puppy's body language. Spend some time. Especially, it is very, very important for owners to be at the puppy's level, that is sitting on the ground and communicating with the puppy, playing with the puppy, reading the puppy, his walk, his gait, his sitting postures. These information are very important, because this information, if anything goes wrong, you can pick up a phone and speak to at least your vet that something is wrong. And invariably, when owner says something is wrong, the veterinarian is keenly looking into the pet, because he knows that their parents have found out something which is beyond the normal activity of the puppy. Make sure your puppy gets a balanced and right amount of a nutrition, because the nutrition is very, very important for this puppy to develop into an adult, and that is a foundation for his old age. Similar to the puppies, the kittens, I think Vishal, the kitten slide.
Okay.
Similar to the puppies, the kittens healthcare, kittens are also growing up, going through amazing transformation. However, there is a little bit of a difference between the puppies and kittens, is that the kittens develop their eyesight a little later than the puppies. Their social behavior also develops a little slower, but then they go through the very incredible growth development. Socialization has more and more important for a young kitten, because that's how they are getting tuned to the handling by various people. So unwanted behavior, aggression, ill temperament can be avoided in adult cats. Next slide, kids. Vishal, next slide. Thanks. Now, some of the similar kittens health tips are, it is again coming back to the body language. Body language of the animal is most essential, so that you know when the puppy or kitten is not doing great, or falling sick, or having some or the other distress. Make sure that your kitten gets a right amount of a nutrition, and obviously kittens need a lot of sleep. Always remember, for all the young puppies and kittens, the sleep is very, very important, and as far as possible, do not disturb them from the sleep. If any abnormality noted, please speak to your vet. When we talk about the kitten and puppy sleeping, it is absolutely essential because these are the things which result into the irritability at a very young age, may result into the anxiety, may result into the hyperactivity or neurotic behavior in them. So these are the problems which start at a young age, which are very much avoided for a better mental development or mental health of the puppies and kittens when they become adults. Obviously, when a lot of people handling the puppies or kitten gets more and more confident, normally when we are talking about the health of the puppy, please consider the physical as well as the mental health of the puppy or a kitten. Always follow your veterinarian's recommendation as far as the deworming and vaccination schedule is concerned. The next.
So the next question to you is, sir, what are the different types of worms which usually affects the pets, and what are the problems they can cause to the pets?
The different types of the worms affecting the pets are the most commonly the hookworm, whipworms, roundworms, and tapeworms. In our country, the presence of a heartworm is not yet investigated thoroughly, and there is no clear-cut evidence-based suggestion for that. It should be there. There are different types of worms which circulate through the blood, but actually the lesions in the heart are not noted. So we do not consider right now in our discussion. So hookworm, roundworms, tapeworms are the most common infection. What we see, they appear very typically. I think most of the pet owners have seen the round, thready, noodle-like worms. The whipworms are again similar-looking worms. Hookworms are very, very difficult to find out with the visual eye, and tapeworm segments we have seen it. Normally, the worms are seen at the bottom of the on the rectum, perianal area, or you can see in the stools. That's how you identify the puppy has got a physical stool or a physical worm infestation.
Thank you, sir. So now we have a poll questions for audience. And the first poll question is, what are the percentage of cat parents they think the minor problems in cats would resolve by itself? You can simply, you just need to scroll if you log in from the mobile phone to enter your answer, or you just type your answer into the chat box, and the options are around 10%, around 20%, around 30%, or 40%. So what are the percentage of cat parents they think the minor problems in cats would resolve by itself? You have hardly 30 seconds time. I hope most of you already entered your answer. And the correct answer for this particular question is around 40%, that is 38% to be precise. The cat parents, they think that the minor problems in the cats, it resolved by itself. But we all know the cats, they are very good in hiding their symptoms. And once this problem developed, it's really difficult sometimes pet parents to recognize. And if we delay and if we prolong the preventive health checkup, it may not be recognized on time, and it may turn into the fatal situation going forward in future. Sir, the next question to you is that how pet parents can identify that their puppies or kittens have worm infestation or worm load?
So in my last slide, we were discussing about how do the worms can be identified in the puppies. The most commonly, we see the worms in their feces. Sometimes in a young kittens or puppies, they vomit the worms. Sometimes you can see the puppy's bottom are stuck with these live worms. Dogs and puppies which drag their bottom across the ground is one of the most common signs which people explain to the veterinarians. Sometimes the pet have a very bad coat condition, dry, rough coat, and most importantly, there is weight loss despite of a good appetite. Weakness, dehydration, lethargy, these are the symptoms as the worm population starts increasing in a young animal. There is a severe anemia, And some cases, puppies also come with a very distended abdomen, and especially in the kittens, the abdomens are so distended that it is very difficult for them to keep their balance. So these are the few signs, visual signs, which we can see. Obviously, through all these things, the simple explanations are pale mucous membrane, pale abdomen, lethargy puppy with a pot-bellied condition. So please take care of, please watch for these signs, and that's why it's very, very important. Be communicating with your puppies, keep watching the puppies and kittens.
Sir, and many pet parents also ask that does it also impact the skin and coat or condition of the dogs or cats or the puppy or kittens?
The type of a worms which normally present in the body of these young dogs and cats, there is a source. Is the most important is probably from the mother or probably from the soiled nipple of a mother, and they ingest a young puppies and kittens ingest these worms, and the worms start sharing the nutrition. So automatically it takes the blood from the intestinal tract. They causes anemia. They do not allow the nutritionally balanced development of the puppies, which result on the coat and condition of the puppies.
Thank you so much, sir. The next question is, sir, what is the schedule of deworming in puppies and kittens?
There are various schedules available for the puppies, which we normally refer to as evidence-based. Normally, we follow the schedule which are given by the companies, but the most important schedule which is being presented by AHA or WSAVA for deworming these kittens, we start deworm the kittens and puppies, which we start at the age of 3 weeks, and thereafter we deworm them every 2, 3, or 4 weeks interval till they are 6 months of age. Now this interval varies because the variation happens as the puppies have been kept at a different places. Like in the breeders, when there are multiple puppies, multiple adult dogs, probably it is wiser to deworm them every 2 or 3 weeks. When it comes to the owner's place, probably we talk about 3 to 4 weeks deworming schedule. And this is very important because please understand that when we are deworming to kill the adult worms. So there are various stages in the life of that worms, which becomes an adult in a period of 3 to 4 weeks, and we repeat the deworming to remove the new adult worms. Be aware that there are lots of medicines available over the counter, but your veterinarian is the best source for this medication, so follow its instructions.
Sir, and what you will advise if in case a female dog or maybe bitch or a twin is pregnant, particularly in pregnant pets, how deworming is advisable or not?
See, the pregnancy will not have any effect of the deworming. But again, please remember, when you are all selecting the worm medicines, please remember to go through the data sheet. Every medicine has a data sheet available with it. So please refer to your veterinarian. Your veterinarian is the best person to tell you the safer medicine during the pregnancy. There are effective medicines available. There are safer medicine available for the pregnancy, which will not alter the growth of the baby puppies or kittens.
And sir, another question attached to this deworming per se, is it advisable to rotate the medicines? Because many times pet parents, they think that one medicine, if we use once, it may not be effective for second time. So is it advisable to change the dewormer every time or not?
I think this question is very, very important and interesting question, because in my practice also, there are people who have come that they have used the medicine for a longer time, the same medicine, and then they come back to the veterinary clinic that the medicine is no more effective. There are lots of factors which involved with it. The reinfection within the premises is the most important factor. Similarly, the fleas carry the eggs of the tapeworms. So when you are deworming your pet, please remember that along with that, the other insects also to be taken care of. So when you're deworming, the treatment also should be taken care of for ticks and fleas, or especially fleas which carry the eggs of the tapeworm. There is no harm in changing the medicine, and I will always like to insist that please carry out the stool examination to know exactly what sort of a worms we are talking about. So in stool examination periodically carried out will give you more information on the worms, as well as then the selection of a choices what medicine you can use. You can change the medicine if you want, but it doesn't make much of a difference if you have been given correctly, and the other factors like an environmental factors are taken care into the account.
Sir, another question on the same line. So many pet parents, they have both dog as well as cat at home, and sometimes they accidentally use the medicine which is intended for a dog in cats. Is it advisable or is it not?
When we talk about the triple dewormer, which is one of the most common used in a dog, the one of the component of which is parental in it, which sometimes show the neurological symptoms in cats. Similarly, few products are available which is also a combination product of an ivermectin with a praziquantel. These two medicines should be used very, very carefully. Avoid the accidents. Normally, I will request people to keep a dog deworming medicine separate and cat deworming medicine separate. I would like to just add one point in it. See, these worms are also transmittable to the human beings in a various forms. I don't want to go much detail of that. Remember to carry out some hygiene procedure when you are dealing with this deworming procedure, removing the stools, litter from the cats or dogs, cleaning the common areas, especially the areas where the dogs and cats poop. So outside surrounding, please remember to wash your hands before you sit for eating and drinking. That's how the human beings get infested with worms. So the worms are transmittable to the human beings, and that's a big challenge right now.
Thank you so much, sir. Now the second poll question is regarding the immunity of the puppy or kitten. So at what age is the immunity of a puppy or kitten is the weakest? Basically, which is we can call as a immunity gap in case of a puppy or kitten. And your options are between first and second week of their life, between second and third week, between fourth and 12th week of their life, or between fourth and fifth month of their life. So which is the most weakest period where immunity gap actually observed in case of a puppy or kitten? You can type your answers into the chat box, or you can just select any option by clicking on the option. So this immunity gap is occur when there is a diminishing complete, or you can say decrease into the maternal antibodies, and there is no development of own antibodies because of the vaccination. So there is a gap between immunity, and this is the time when the puppy or kittens, they are most susceptible for any infections which is present in the surrounding. And the answer is between 4 to 12 weeks. During this period of time, the maternal antibodies goes down below the threshold of protecting the puppy or kitten, and the vaccinations is not started, and post vaccination also some or weeks time or 2 to 3 weeks time is taken by the body to develop the own antibodies to protect against that infection. So hence you will observe that 4 to 12th week is the immunity gap where the pets, they required maximum immune support, and this is the time when there is a chances that they acquired some life-threatening or deadly infections. With this, the next question is to sir, what is the ideal gap should be kept between deworming and vaccination?
The
Sir,
gap
would you
between,
like to also add what immunity gap we discussed, sir?
so I will suggest that there has to be a gap between the deworming and vaccination, because both take a toll onto the body. The deworming sometimes causes a heavy infestation of a worms to die, and then expelling the worms from the body itself is a stress to the animal. And in any of these stressful events, the vaccination, which takes further stress from the body, doesn't work very well or to its effect. There are certain diseases in the vaccine which produce a gut-induced immunity, and it is absolutely essential that gut has to be healthy, and therefore there has to be some gap between the deworming and vaccination. In a young puppies, in my clinic especially, I keep around 5 to 7 days gap between the deworming and vaccination. But this is the reason that we should have some gap between the deworming and vaccination.
Thank you so much, sir. So as sir suggested that there should be at least a gap of 5 to 7 days between deworming and vaccination. The next question is, sir, what are the common deadly pathogens against which immunization or vaccination is recommended for pets?
We
Yes, sir.
go with the canine and feline infections, and which are one of the most common and deadly infections what we have for feline is feline panleukopenia, feline rhinotracheatis, feline calcivirus, feline leukemia virus, feline bordetella infections, and rabies. Out of these, rabies is highly fatal and zoonotic, and it's of most importance. Please understand that cats do transmit the rabies to the human beings, and it's equally fatal for a cat as well as a human being. All susceptible cats are exposed to the infection in their first year of the life, and this is the reason why we all should be taking care of our kittens to get the vaccinations on time. The kittens are most affected with these infections. So if you see the symptoms wise, you will notice that most of the kittens pick up an airborne infection which causes the upper respiratory tract infection, ocular discharge. There is a chronic conjunctivitis, there is a fever, there is a sometimes diarrhea, weight loss, swollen lymph nodes. There will be obviously a clinical sign variable due to the immunosuppression, and these are the virus they pick up from the nature. The source of the virus is airborne. Sometimes humans themselves carry the virus about from the saliva of an infected animals or nasal secretions from the animal, sometimes urine, feces, blood. These are the things which are transmitted with our own clothing to the healthy kittens or healthy cats, causing the disease. Few of the most important disease from the clinical point of view, which is called the feline panleukopenia, which causes a diarrhea, vomiting, depression. Sometimes the feline panleukopenia results into the seizures. So therefore, the symptom-wise, it is also known as a feline distemper. Feline panleukopenia is a highly contagious and it is very fatal disease, especially in the kittens all across the globe. Transmission directly between the cats, indirectly through the shared food and water bowls. Sometimes the grooming items what we use from one cat to the other, which includes the mops, sometimes the towels, humans transmit through their hands and clothing and shoes, and these are the very, very difficult time where owners do not understand that why my kittens are falling sick. These are the diseases which we see normally in a multi-cat fold house or in a cat shelter or where there are a large number of cats staying together. Feline rhinotracheatis is another virus which results into the sneezing, nasal discharge, conjunctivitis, and this has also more of a same transmission. The indoor-outdoor nature of a cat makes it very, very prone to pick up these airborne infections, and they are very, very critical for the owners and for the animals because they spread very widely across the kittens or across the cats. The last is obviously the rabies, and we can keep talking about the rabies. It's a fatal disease. please understand that it is a highly zoonotic disease. It produces neurological signs by attacking the nervous system. So these are the few of the feline diseases. Coming back to the canine diseases, again we talk about most common canine distemper virus, canine parvovirus, canine adenovirus, which is producing the infectious canine hepatitis, and some of the respiratory tract viruses by canine adenovirus. We have a leptospirosis and a rabies. Out of these, leptospirosis and rabies are highly zoonotic. That means animal to man transmission is very common. Both are fatal in animals as well as humans. So high mortality is very, very important to understand in a rabies and leptospirosis. So these are the few most common diseases which are much serious in nature. They are all preventable diseases, and the vaccination is essential.
Sir, I just want you to little bit elaborate how leptospirosis is usually transmitted to the pet owners, because rabies we know at least, but leptospirosis is something which is not very known to the audience.
The leptospirosis is basically zoonotic diseases. It's the rat's urine which carries the leptospira virus, Leptospira rickettsia, and it is very interesting to know that it is seasonal, more related with the monsoon, more related with the flooding of the rat holes where rat's urine comes out, and if there are any dog for that matter or human beings walking into these flooded water which is contaminated by the urine of a rat, they will always pick up the infection. If you see specifically in my practice, I realize that a lot of dogs with the photodermatitis or infection between their paws, red paws, itchy paws, wound in the paws, when they walk into the monsoon, first few showers, first few flooding, they pick up the infection through their paws. Similarly, if there are any cuts, if there are any wounds in the leg, if there are any broken skin of the leg of a human being walking through the same water in the puddle, yes, there is a possibility that leptospirosis can enter, and it enters and it produces much serious signs. And the serious signs may include probably the jaundice. It will include the kidney failure in an acute form. It results into the bleeding into the lungs, and it causes the blood in the urine. But these are the symptoms which are life-threatening symptoms in dogs as well as human beings.
Thank you so much, sir. What are the cat infections, sir? We already discussed this.
These are the few infections which we have already discussed, and again, rabies is a highly fatal and zoonotic disease. I'm sorry, I will come back again and again to the zoonotic aspect of it, because I do follow One Health practice very seriously, and I would like people to understand that when we love our animals so much, there is always possibility that we can risk ourselves also if they are not properly taken care of or vaccinated.
Sir, now the most hot topic and most questions asked, that what is the vaccination schedule? We will discuss it separately on dogs and cats. So first tell us about the vaccination schedule in dogs.
So the vaccination schedule in dogs. Now, globally, there are authorities who have worked into a separation of a various vaccines with the help of a disease-causing agent. And their separation is only on the basis of its available spread through the world, information available about the pathogenesis or seriousness of the sickness, and its occurrences in a regular, timely manner across the globe. So there is a group of a vaccine called core vaccines, and they include the canine distemper, hepatitis, parainfluenza, and parvovirus, which we all commonly called as a DHPIPV. And along with that, the leptospira is also included, and the leptospira are now available in the various strains from 1 to 4. Ideally, the 3-strain leptospira vaccine or 4th strain leptospira vaccine is being used. Now, this DHPIPV leptospirosis, probably people term them as a 1 in 5, 1 in 6, 1 in 7, whatever the terminology is. It has to be given the first dose between 6 and 8 weeks. and repeated every 3 to 4 weeks till the puppy attains 16 weeks of an age. Many times vaccine 2 doses are given and they end at the age of around 10 weeks or 12 weeks, and people or veterinarian has to give the 16th week dose for a solid immunity which lasts for about a year in our place, because we are endemic area for the leptospirosis. When it comes to the rabies vaccination, first vaccination is given at the age of 12 weeks and repeated after 4 weeks, because we are endemic for rabies. India is #1 country after the African continent for the endemic nature of a rabies virus. Most of the vaccinations are repeated annually, but in India, whereas some of the countries, the vaccinations are repeated after 3 years. So whichever conditions applies to which goes with the vaccine manufacturing data sheets, duration of immunity is always mentioned, and look for the status of an epidemic or endemic nature of the infection in your area. So your veterinarian can take that decision how frequently to vaccinate your dog.
Sir, I have 2 questions regarding this. So first is about vaccination in pregnant animals, and second thing, many of pet parents, they do believe that vaccination happened by using a imported vaccine or Indian made vaccine make a difference, or a vaccine which is given at a government shelters is different than the even in a private setup. So what is your take on this?
First of all, the first question was an adult vaccination. An adult vaccination program is very, very effective if you vaccinate your dog. And will it be effective equally if I vaccinate 2 or 3 vaccines together? Yes, as long as the body receives the 3 vaccines as per the manufacturer's information at the 3 different locations on the same time, it will work in an adult dog very well. Now, second question was whether there is a difference between the Indian manufacturer vaccines or vaccines which are imported vaccines used for the shelter. I think there is a global consensus on what vaccine manufacturers are producing a data sheet. So the data sheet is being globally produced, verified by the authorities, competent authorities. Even in India, there is a competent authority which goes through this list. When there is a vaccine shortage, couple of years back, we all have gone through that vaccine shortage, whether it was for the private or whether it was for the shelters. The vaccine shortage happened everywhere, and this happens only because company failed to provide a data sheets to the government of India. Please understand that equally government of India is interested in protecting your pets, provided company follows the norms of receiving the data or receiving the permissions from the government. So whether it is Indian vaccines or whether it's imported vaccines, the data sheets which is produced by the vaccine companies is the most important source which tells you the authenticity of a vaccine.
So now tell us about the vaccination schedule in cats.
Like a cat also, like a dog also, the cats also receive the vaccination as a first dose between 6 to 8 weeks, and it has to be repeated 3 to 4 weeks later till the kitten reaches to the 16 weeks of an age. Normally we vaccinate cats for feline parvovirus, which is also known as feline panleukopenia, feline calcivirus, and feline herpes virus type 1, which is rhinotracheitis virus. So that means that we are vaccinating your cat for the feline distemper, feline upper respiratory tract infections. We are also vaccinating your cat for the typical oral lesions, gingivitis, stomatitis, and eye discharge, ocular discharge, the virus which produces these symptoms. Rabies vaccination in case of a cat is essential, and it has to be given at the 12 weeks of an age. Please repeat the rabies vaccination after 4 weeks in an endemic area. all 4 vaccines are annually repeated in India, but someone can opt for giving the vaccination every 3 years if the manufacturer of the vaccine produce the data sheet with the immunity within your area. The common questions people do ask about what happens to the coronavirus. The coronavirus vaccine is now also considered as a non-core, non-essential vaccine along with the Giardia vaccine. But there are countries where there is a possibility of a kennel cough, bordetella, or chronic respiratory disease complex, which covers the bordetella, parainfluenza, and the other organisms as a complex group. Bordetella vaccination can be introduced, 2 vaccinations at 8 weeks apart.
Thank you so much, sir. Sir, already you explained about the adult dog vaccination. So in the interest of time, I'm just skipping this. And please explain about break in immunity. Sorry for this slide. So now, sir, we will directly take some questions of the pet owners, which already we received. Now it's already 4:50. We will try to answer these questions. And first question we received from Sadia. Please excuse me if I pronounce wrongly. She and her question is basically she wanted to know there was a streak of blood which observed in the stool of her cat in the past, and she wanted to know was it because of the food or was it because of the deworming and also.
So there is always possibility that in spite of a deworming, your cat or a dog can get a reinfestation of a worm. There is always possibility that your dog or cat is sensitized to the food ingredients, and that is also essential for us to understand. So in your case, when you change your cat's food, I'm sure you are deworming very well in time and as per the schedule. If the change in food has brought the health of the animal back, condition of a quality of a stool back to the normal, then your cat possibility has a food sensitivity if the deworming is regularly followed.
Thank you so much, sir. The next question is about the Yash, and he is
So
having
these are the few causes about the blood.
Yeah.
So people can notice that worms, anal sac, sometimes irritation, diet sensitivity, which food ingredients you have changed, inflammatory bowel disease in older cats. Sometimes the stress also results into some bleeding in the stools. Remember, in the middle-aged cats, neoplastic disorders or gastrointestinal tumors are also to be considered when you see a blood.
Thank you so much, sir.
But you are lucky that just a change in food
worked. Sir, the next question is of Yash, and he wanted to ask whether an adult dog whose vaccination history is not clear, so can we give him a second shot to ensure that his immunity status is right?
I think you can go on to the next slide, Vishal. But remember that you can vaccinate any dog at any time, especially the adult dog receiving a one single shot, and keeping in mind that data information from the company states very clearly that you can give one single shot. When you are giving a shot together, probably remember that there are brands which will tell you that you can use the 2 vaccines together, but never mix vaccines of a different company, different brands, which are not required. You can use the 2 different brands at a 2 different locations in the body, and body can handle it very well at the same time. So giving an additional dose of a vaccine, if it is given correctly, will not interfere with any previous history when it's unknown.
This is post-vaccine reinfection. So we had a case where a puppy was already affected. This is a case by Prapanna, and who shared that the dog had a parvovirus infection back in November 2021. but now the dog is recovered, but he is in a dilemma whether when he will do the next vaccination before the schedule, or maybe he can delay the date of vaccinations.
Most important thing for us to understand, in spite of a vaccination, there is a reinfection happening. This is really frustrating for the owners as well as veterinarians when they give the vaccine and then there is a reinfection in spite. And there are certain possibilities why these sort of things happen, where we talk about vaccine failures. Many times the vaccine is perfectly normal within the manufacturer's premises, but by the time it has come to us, there are lots of temperature differences, and the temperature is critically maintaining the potency of the vaccine. There are also certain inherent characteristics of the vaccines which is very, very important for us to understand, that no single vaccine will give you 100% protection. Remember that there are certain breeds which are predisposed for the infection in spite of a vaccination. And when we talk about vaccinations, we always talk about the healthy, dewormed pets vaccination, whether it's a dog or cat, to ensure very close immunity to almost 100%. So there is a possibility that reinfection happens because of the certain any of these elements. But most importantly, now, if you have to vaccinate the puppy again, please vaccinate as per the vaccine schedule. That is either annual or every 3 years as per the vaccination used by your veterinarian previously.
Thank you so much, sir. And the next question is by Shreya Anand, and she's talking about her Cocker Spaniel who is getting tapeworms, who actually had a tapeworm. She does deworming regularly, but still that infection reappear. So what is your take on this?
Because there are different types of worms, and especially the different types of worms have got a different types of a life cycle. As far as this question is concerned, the tapeworms, they have a life cycle, and fleas is the intermediate host in that. So if your pet has got a fleas, and if you are just giving a deworming medicine, it may not work because the flea produces a severe itch. While itching and biting, accidentally the dog is consuming those fleas in the mouth, going into the gut, flea get digested, the segment or eggs of the tapeworm are released back into the system. So remember that what we talk also is about when you are taking care of your deworming, we have to take care of the other parasites also, which include ticks, fleas, and worms. So now, when we talk about these sort of infections, we always remember that your dog should be free from the ticks and fleas while you are doing the deworming medicine.
Thank you so much, sir. Sir, we also received some of the questions during chat from chat box, and my team had forwarded to me. I'm just, we will try to answer few of them in the interest of time. So the first question is, what kind of a food should be fed before and after deworming? Is there any change recommended in case of in diet? This question is asked by Satya.
I personally feel that there is no reason. The company has never mentioned anything. The food is a balanced food. It will take care of if there is any stress associated with the deworming. Continuing the food which is available of a good brand, or even for that matter, people giving a balanced home cooked food will not alter any deworming episodes ill effect.
Next question is from Rakshita. She's asking that I am a cat parent and my cat is 2.5 years old. I have noticed a lump on the place of half yearly vaccination for 2 consecutive years now. Last time it went away with cream and tablet. I want to know the cause, treatment, and if it is dangerous or not.
Sorry, Vishal, your voice cracked, so I couldn't hear the question.
So the basic question is of Rakshita that post-vaccination lump is developed at the site of vaccination. So what was the reason behind it and how it can be managed, sir?
So the most of the time vaccine reaction lumps do occur, and it is because of the preservative. It's not that the vaccine is not effective. These lumps, your veterinarian can give some medication and take care of it. I would not advise anyone to foment or apply heat or heat pad or medicines on that. These lumps are mostly noted with the rabies vaccination because of the adjuvant, which is giving a stronger immunity for a period of 1 to 3 years. And there are certain lumps which are normal. They disappear with the proper treatment. Consult your veterinarian and he'll take care of it. But continue giving a vaccine.
Sir, any last thought or message for our pet parents, because we are at the end of our session? So any last comment or any last suggestion for every one of us?
From my side, the best is that pets create so much of a happiness. See that happiness continues to all the members of the family. As the pet is happy, the family is happy. I have seen too many sick patients, and obviously the sick patient associated with the sad family. I feel really bad looking at the family members that they also suffer with their pets. Some care, preventive wellness check is absolutely essential. Don't wait till your pet falls sick. Annual or biannual visit to the veterinarians for wellness check is absolutely essential. Blind vaccination, sometimes we have to think, are we going to do a correct thing? It is now new serological tests available to the distemper titer, parvoviral titers. Before you start blindly vaccinating, there are vaccinations. If it is needed, if the titer is low, please vaccinate. Continue to vaccinate in an endemic area. There are certain diseases which are periodic, like a leptospirosis. The best effective way to vaccinate and protect your animal in the months of April, May, June, as per the monsoon is likely to visit your area, please carry out that vaccination effectively. Avoid cats, especially indoor, outdoor activities. If you are staying alone or it's a place which is no neighboring cats, then it is to some extent it's okay. But for me, indoor cats are much safer, better. They are very happy in your own house. Just read about what is called as the environment enrichment in the cats to keep them happy and healthy.
Sir, and what is your take or what is your suggestion to us on this particular campaign called Take Your Pet to the Vet?
With the last 20 months of COVID, we all have learned that life is a very fragile. It's not only the human life, but our pet's life is also. There are lots and lots of difficulty coming up with traveling with the pets, sick pets, availability at the clinics or availability of the emergency facilities. It is always better that genuine emergencies are very rare. If you open any website on an emergency, they are accidents, they are fall injuries, they are electrocutions, they are trauma related injuries. But the rest of the criticalness is a chronic disease which lasts from few hours to few days. We do not or we should not wait for such an emergency. Now, these are only possible if you identify your pet sicknesses very early, and that's why you should have a personal contact with your pet. Try to play, try to have a good contact and relationship with your pet. Pet will tell you that he is falling sick or not, and that will save a lot of trauma to the owners and the family members.
It's a last request to all the pet parents, or rather announcement, that thank you for sending your questions, which actually help, I guess, similar questions of different pet parents also resolved through this particular forum. The winners, those who send these questions, interesting questions, or share their queries, the Royal Canin team will contact them. The details which you have shared, we will try to communicate about it, and we will send the goodies to you after contacting to you. So congratulations, the 10 lucky winners, take the 10 participants will be going to get the gift hampers from Royal Canin. For that, please stay tuned. Please keep eye on the Royal Canin handles, social media handles. And about next event, we will be also sharing our announcement. We will be making announcement soon. So stay tuned. Watch the Royal Canin has social media handles carefully, and we will also request or send you the registration link of the next events as and when it is planned with the dates and events. At last, I thanks Umesh sir for dedicating this time for educating all the pet parents and sharing his knowledge and his expertise with everyone. I hope all of you will get benefit of it, and it will be helpful for your pets. At the end of day, everyone we want that pet should live longer life. We want to create a better world for our pets, because pets, they make our world better. So thank you so much, sir, for your time and your participation and your support. And thank you, pet parents, for attending this particular session. And see you soon for the subsequent session. Our team will let you know about it also. Thank you so much.
Thank you, Vishal. It was an amazing experience, and I hope we can continue and educate clients. Whenever there is an opportunity, I will be happy to be with the team. Thank you.
Thank you so much. With this, I request the backend team to please conclude the today's session. And thank you so much, guys. Have a great rest of the evening. Take care, guys. Bye-bye.